mom, dad. Again, I have my best friend on the phone right there. So let's get into it. They're each provided with some sort of handout that looks like this. It is just talking about all the information with some charts, images, better way for them to get a good hold of the information. So let's get into it. Pregnancy is met with a lot of different emotions, from months of hormonal and body changes to unique food cravings to the actual birth of the baby. There are a lot of unknowns that may occur. However, once the baby is born, a happy moment can overlook the condition of the mother, who might be dealing with the after effects physically and mentally. Hello, my name is Alyssa Stolarsky, and today I'm going to be talking about postpartum depression. So right in front of you is this handout, and we're going to be talking about the difference between postpartum depression from postpartum blues, postpartum psychosis, some screening tools, some signs and symptoms, treatment, and interventional studies. So before you know it, let's get into it. So the main difference between postpartum blues, postpartum depression, and postpartum psychosis is one, whether or not you have psychosis symptoms. So if you have a background history of any bipolar disease, major depression, if you're experiencing hallucinations or delusions, or hearing anything or seeing anything that makes you want to have these thoughts of harming your baby or yourself. That is what differentiates between postpartum depression and postpartum psychosis. Now, the difference between postpartum blues and postpartum depression is time. The main difference is that postpartum blues will resolve anywhere from up to a couple days to up to 2 weeks, whereas postpartum depression lasts a lot longer than 2 weeks. Now, postpartum blues, a lot of the symptoms are the same. You're going to have increased agitation, difficulty sleeping, eating, doing your normal activities, but they will resolve on time. It's a mild and transient depression. Like I talked about with postpartum psychosis, you're having those hallucinations and delusions, and this is an emergency. You are going to want to get help, and it's treated depending on the severity with antipsychotics and some therapy in psychiatric care. Now, according to Bellin from 2023, some of the symptoms, things you might hear are I'm not like myself, or this isn't like me, along with those feelings of sadness, fatigue, irritability, changes in appetite, sleep, mood swings, trouble focusing, and thoughts of harming yourself or the baby. Postpartum depression, according to Carlson, Mogul, and Farm from 2024, is experienced by 9 to 24% of women during postpartum. There's a 12% incidence of PPD among healthy women who gave birth to healthy infants. This is due to the fluctuating levels of hormones from your estrogen to your progesterone, your cortisol, which is your stress hormones, oxytocin, which can be a happy chemical, melatonin, your sleep, thyroid also can contribute to sleep. And after birth, those neuroinflammatory processes, abnormal levels of dopamine, norepinephrine, serotonin, and then maternal nutrition. The target audience is new mothers to infants younger than 12 months old. It occurs in 1/7 of women, may begin during pregnancy or up to 4 weeks after delivery. It's more common in patients who are adolescents or deliver premature infants and who live in urban areas. So preventing postpartum depression, just making sure that you're sharing your emotional problems with your family or friends, getting your daily exercise of at least 30 minutes every day, changing your environment of at least 30 minutes every day, making sure you're sleep when your baby sleeps, eating a balanced meal, as well as not overcommitting yourself, making sure you're getting plenty of rest, asking for help when needed, and also finding support groups. There is a postpartum support international hotline, as well as the HHS maternal mental health hotline that is listed. And if needed, I can provide those phone numbers after this talk. So I just have a chart, and I could show it to you guys as well, of just showing, some of the foods that are healthier and further emphasizing what you should be doing to prevent PPD. Risk factors, this can be psychological, obstetric, social, or lifestyle. So it includes, again, history of depression, anxiety, any types of abuse, adverse life events, and if your family has a history of psychological disorders. Obstetric, if you have a high-risk pregnancy, preterm birth, emergency C-sections, or an unplanned pregnancy. Social, lack of support, again, any violence, domestic violence. Smoking, a young maternal age, so if you're unmarried or divorced, less than 24 years or 35 years. And then a poor lifestyle with decreased physical activity, poor diet, poor sleep. Screening for PPD, there are two main types. This includes the Edinburgh postnatal depression screening. If you score a 12 or higher, then they will want to assess further. And it's basically just a ton of questions that you'll fill out and rank your score at the very end. They also have the Patient Health Questionnaire 9, which is very similar to that, asking you more questions. And it's recommended that you get screened at the infant's 1 month, 2 month, and 4 month visits. And then here's a picture just of what those screenings might look like. Signs and symptoms. We already talked about that, but if you're having these various different mood swings that are very unusual to your normal lifestyle. Treatment, I kind of touched into this earlier, but first treatment is psychotherapy or antidepressant medications. They'll usually use cognitive behavioral therapy or psychotherapy, and it's a 6-week trial for the medications. They'll use serotonin reuptake inhibitors, and then just a ton of peer support groups, as well as fixing your sleep. But again, this is all determined on the severity of the situation. And according to Kumar and Avin, there are 2 different interventional studies that I found that talk about mother-focused versus mother-child-focused intervention studies, where the mother-focused was more based on maternal depression, mother-child-focused was more based on infant management and interaction. And it was a very positive study, I think among, I want to say it was around 31 different groups. And then I just have a little handout again. So to clarify, we discussed what is PPD, what is the difference between postpartum blues, postpartum psychosis, what are some risk factors, screening tools, prevention methods, signs and symptoms, and then what are some treatment methods if you were to get PPD or you know someone who might be experiencing PPD. Thank you.